Because I think this general election really is about the future of the National Health Service. You've got 4.5 million people now on the waiting list. You've got 660,000 people waiting beyond 18 weeks for treatment. That's often waiting longer and longer for an operation, whether it's a knee replacement or a hip replacement or a heart valve operation. Well, let me put it like this. In the last year of the Labour government, in 2009, there was about 50,000 people on a trolley across the year in a hospital, which is not acceptable. I'm not saying that's something to be proud of. But whereas it was 50,000 in the last year of a Labour government, do you know what it was in the last year of this Tory government?
200,000.
It wasn't 50,000, it was 620,000. That is the scale of the deterioration in our National Health Service after a decade of cutbacks and a decade of undermining the staff in the NHS under these Tories. Jeremy Corbyn has been passed the secret documents detailing the extent of the detailed negotiations between this Tory government and the US government about a trade deal. And there's 450 pages of documents, so they're very detailed and they're very dense, but you must look at them because it's explicit in there that services are on the table in a trade deal. That therefore includes the NHS. And pharmaceuticals are on the table, and that therefore means that we will have to pay more for drugs. And it will also fundamentally mean that the NHS is forced to buy US medicines at higher prices. In fact, there's one academic came out and said, it will cost the NHS £500 million a week. Not £350 million a week for the NHS, but the NHS cost £500 million a week under Boris Johnson's plans. The Tories have privatised huge swathes of the NHS. £10 billion worth of NHS contracts have gone out to the private sector. So we want to sweep away this privatisation agenda, end this racket, and bring these contracts back in-house, reverse privatisation. You've got so many of our young people who are in desperate need of help and support. Young people who are trying to harm themselves, or young people who've even tried to attempt their own life. But they don't get the specialist help that they need because the children's mental health services have been cut back so much under these Tories. Because I know that when the local hospital was privatising some of the staff over there to what we call a wholly owned subsidiary, you were part of the campaign with the trade unions. You stood shoulder to shoulder with those workers who were being transferred out to the private wholly owned subsidiary vehicle. And although the hospital went ahead with it, one of the announcements that we put in our manifesto is that we're going to end those privatisations and those workers are going to come back into the NHS as well, because that's one of the things we're going to do. It's literally got people queuing up to get in the front door of a hospital, and you'll see more and more as in the coming weeks, I suspect, as things get colder, ambulances backed up outside your hospital here. So people are queuing up to get in the front door, and then people are queuing to get out the back door because they can't, if you like, out the back door if you like, because the social care support in the wider community has been absolutely savaged under the Tories. But just imagine, ask yourself, what will the NHS look like under 5 more years of Boris Johnson? So we're going to invest, we're going to train more GPs, which will mean more GP appointments in Chesterfield. We're going to put 12 billion extra into social care and introduce free personal care as well, for our elderly as well, as a way of resolving the social care problems. And of course we're putting more money into hospitals itself with our £26 billion rescue plan nationally. And also we're going to recruit more nurses as well by bringing back the training bursary. So we have a plan to rescue our NHS also.